The research I'm about to present that is published in the British Medical Journal is a case report. However, the results were incredibly amazing, or I should say astounding, in regard to basically what was an immediate cold water immersion by simply jumping into the sea. Neither patient nor medical practitioner anticipated what was about to happen next. To proceed forward as follows. Cold water plunge provides instant pain relief. To narrate, after reviewing the literature, no similar case reports of cold open water swimming. Remember, this was not cold bath or anything like that, which a lot of studies have been done on. This is just basically just jumping into the sea, the cold sea per se. Curtailing postoperative pain and associated immobility could be found. Although there was considerable literature on aquatic rehabilitation and cold water baths in sport medicine, cold water swimming as described in the table, which you will see a little bit later on, to the best of the author's knowledge, has not been described in the context of postoperative care. A short, sharp, cold water swim may offer an alternative to strong painkillers. Not just a strong pain alternative, it's like a cure, where painkillers require constant use. In this case, per se, or at least with chronic pain, in this case, per se, it all went away. But again, case report as we proceed. In physiotherapy to relieve severe persistent pain after surgery, suggest doctors in the Journal of British Medical Journal Case Reports. They reached their conclusions after carrying out a surgical procedure, endoscopic thoracic sympathectomy, on a 28-year-old man to curb his excessive facial flushing. The surgery entailed cutting the triggering nerves inside the chest. The procedure itself was successful, but 10 weeks later, the usual post-operative prescription of strong painkillers and staged physiotherapy had barely made a dent in the severity of this gentleman's pain. The man explained that exercise and movement just made the pain worse, preventing him from completing his rehabilitation and recovery. Furthermore, the constant pain caused him a great deal of distress and wrecked his quality of life. What happened next was an amazement to, again, to both patient and medical practitioner. To proceed. Before his surgery, the young man had been a keen triathlete, so had swum competitively in open water. He thought that a cold water swim would be at very least provide some welcome distraction from the searing pain. He returned to the same coastal spot where the triathlon, or his triathlon, took place. The only way to enter the water is to plunge in from a rocky outcrop, he explained. Competitors are forced to swim for around 60 seconds before being able to clamber safely back to shore. Did I mention he only had to do this once? And then it was gone? To proceed. To his surprise, the young man felt no pain while he was in the water, but nor has he felt any since. The authors report his preoperative quality of life had been fully restored, and he has resumed his usual sporting activities without further recourse to any painkillers. Now we're going to proceed a little more detailed into the records as transcribed by the doctor and the patient per se. Keep in mind this was a case report, but it opens up an incredible possible venue of new research in regard to pain treatment, or in this case, pain cure. To proceed with the chart that you see there. All right, obviously this was unsanctioned by health professionals, because who would have known? The water, or approximate ambient temperature, I should say, not the water, was 8 degrees centigrade, 46, 47 degrees. Estimated sea temperature was 51, 52. Now keep Fahrenheit, I'm going by, translating, or I should say converting. But keep in mind, he just jumped into the water, so it was an instant immersion. All right, now, the approximate length of swimming, as pointed out here, it was about 1 minute. Now this part I love. This is basically the 28-year-old patient's description of what happened to the medical practitioner. Retrospective self-report during swimming. I, quoting the patient, initially thought, damn, this is so cold, I'm going to die. I just swam for my life. Once I was in the water, I had tunnel vision. For the first time in months, I completely forgot about the pain or the fear of the shooting pains in my chest if I moved. My entire body tingled with the cold. I just know if I didn't keep swimming, I'd soon freeze. So it was kind of like fighting for his life. After a few moments, I actually enjoyed it. It was an immersive rush of adrenaline. I bet I couldn't even feel my pain if I tried, quote unquote. Total session was about 10 minutes, being exposed to the cold as far as the ambient temperature, as well as the water itself, which is about 1 minute or 60 seconds per se. All right. The learning points that the medical researchers in this case want to basically bring to the attention of anybody else looking into this research as follows for future exploration is the following. These are the learning points, which I really like the fact that the researchers actually printed it out as follows. Damage to peripheral nerves after surgery can lead to postoperative neuropathic pain that is difficult to treat and can lead to immobility and worsen quality of life. All right, that's self-explanatory. Here, the researchers, we describe the first known immediate remission of intercostal neuralgia following exposure to the patient-initiated single-session open water swimming in extreme cold conditions. This is an interesting hypothesis. Forced cold water swimming may trigger a surge of sympathetic activity and catecholamines that may provide short-term endogenous anesthesia and allow aggressive manipulation of the kinetic chain under pain-free conditions. Forced cold swimming overcame reluctance to engage in pain-provoking postoperative mobilization and was associated with curtailed chronification of pain/mobility. Future studies are recommended that need to be developed in a rigorously ethical way. Just don't throw random people into just cold sea. You know, how can happen? Hypothermia per se. And I should say, so when anybody was trying this or working to research it, controlled conditions. Further studies are recommended that need to be developed in a rigorously ethical way in order to attempt replication of positive outcomes after exposure to cold water swimming for post-operative neuropathic pain and immobility. So what you had here is a combination of events. One, instant immersion into cold water, and then two, immediate forced need to move. Otherwise, drowning could be the result per se, or hypothermia, or to reach shore. So it's basically kind of like a panic condition mixed in with the cold water immersion, which basically forced the individual per se to totally not think about pain, but more about initially survival, which tend to break that chain. And henceforth, the pain never returned in this one case report. To conclude with the remainder of the research in regards to the outcome, interestingly, contrary to the patient's expectation of severe pain, remember the patient didn't think he was going to get cured of the pain. He was just doing it for distraction. The patient unexpectedly reported no provocation of pain during swimming. Since the point of water entry, the patient had reported no further episodes of intercostal neuralgia and reports being able to move and exercise freely without pain. Exposure to cold open water swimming appeared to provide an immediate and lasting anesthesia, during which time pain was undetectable. Since exposure to the swimming event, there has been a full return to preoperative levels of mobility, sport, and quality of life. Regular opiate and simple non-steroidal analgesics have since been discontinued by the primary care provider. Henceforth, success. This is a wonderful, wonderful new avenue of approach that tends to make logical sense per se, but obviously needs to be validated with future clinical trials, and hopefully, as soon as possible, as this may open the door to other researchers now to say, hey, let's try some sort of forced mobility as well as an instant cold immersion. It was only in the water for 60 seconds. Keep in mind, this is a case report, so this may be a best case example. But to have no more pain afterwards, that's incredibly, incredibly amazing. Again, this is Ralph Church Channel signing off once again. Thank you very much for listening, and I hope to see you all again in 7 days. And as always, thank you.